The COVID-19 pandemic has resulted in a high demand for medical supplies all over the world. Max vaccine rollouts mean countries need more needles and syringes than ever before. Prices have increased, and here in South Africa, they have doubled. So how are the manufacturing companies of these products managing to meet the demand? To find out, Masego Rahlaga spoke to a company that supplies some 190 countries.
COVID-19 is wreaking havoc in South Africa and particularly in Gauteng. It's doing the same around the world. We've seen it plunge the health systems of many countries into chaos, including Italy and more recently India. And with countries racing to achieve herd immunity as the virus mutates, the rollout of vaccines has increased. This means more pressure on companies supplying needles and syringes.
Firstly, with the start of COVID, and then obviously with the intention to do global vaccination programs, that has led to a dramatic increase in the requirement for syringes and needles.
It also means there have been disruptions in the supply chain, and some countries found themselves running out of stock, personal protective gear included.
But all of a sudden you have 3 months worth of stock, and in 1 month it's gone. And that's not gone just in South Africa, it's gone everywhere in the world. The extent of demand in the healthcare sector way outstripped what was ever in the supply chain. And in some areas it's still happening today.
And with lockdown regulations and travel being banned, it has become worse. But some lessons have been learnt.
Where we are today versus, I would say, 6-9 months ago in the COVID cycle, I think companies have learned, the ports have learned in terms of managing the logistics cycle. But if you go to wave 1 last year, there were tremendous issues in terms of access to flights, access in terms of logistics into country. And because COVID was new, so all around PPP, the kind of social distancing, reduced staff, that meant there was a huge backlog at points in time and difficulties in access. I think the plus points is most companies have been adaptable, the logistics providers have been adaptable. So we're probably in a much better situation today.
The company says it's already received orders from the South African government and other governments for next year, with many afraid of running out. In a written response, the local health ministry said the cost of needles and syringes has doubled since COVID-19 broke out. It says Treasury has procured another contract and awarded a tender to ensure sufficient supply. Masego Rahlaga, Johannesburg.